All right, we're going live. Gotta love technology.
Good afternoon, everybody. My name is Dr. Liem Lee, and I'm going to be coming here speaking to you guys about integrative medicine. Thank you to Debbie's Dream Foundation for inviting me to speak. So I'm just going to give you a little background on myself. I have a master's and a doctorate in Chinese medicine from Pacific College of Oriental Medicine in San Diego, and also have another master's degree from University of Western States in functional medicine and human nutrition. I'm the contracted Chinese medicine doctor for Moffitt Cancer Center here in Tampa, Florida. I'm also the head medical advisor for an herbal company, Elix Healing in New York City. I'm also on the teaching staff for the University of Western States in the Human Nutrition and Functional Medicine program. And recently this year, I've received a scholarship to go through the fellowship of the Academy of Integrative Health and Medicine. So here we go. So today's agenda, I'm going to talk to you guys about integrative medicine, Chinese medicine, massage, yoga, and meditation, and how these can benefit those with gastric cancer, or actually any buddy going through their cancer journey. What is integrative medicine? Integrative medicine is a healing-oriented medicine that takes account of the whole person, including all aspects of lifestyle, and it emphasizes the therapeutic relationship between the practitioner and the patient. It is informed by evidence and makes all appropriate therapy, makes use of all appropriate therapies. Now, it focuses on the unique characteristic of an individual person and the interaction of the mind, body, and spirit in the community. In Chinese medicine or integrative medicine, we believe mind, body, and spirit, but I would also like to include community in there because our community, whether it be our family, the people we work with, or our friends and people that we interact with, impact how our mind and body functions. The philosophy of health based on the balance of the mind and the body and the spirit is not a unique or new to unique or to integrative medicine. This has actually been around the time of Aristotle, and in Chinese medicine has always been a foundation of Chinese medicine, the mind-body connection, which dates back almost 5,000 years. Now, the principles of integrative medicine, I want to stress some of these points here. The patient and practitioner are partners in the healing process. I always tell my patients, I'm not doing all the work, you're also doing the work, your body's doing the work. So if you feel better, I don't take full credit on it because it takes your body to actually heal itself too. So it's a two-way relationship. We work with each other because I can't do all the work. You guys have to carry some of the load too. Appropriate use of both conventional and alternative methods facilitates the body innate healing process. I always tell my patients, you go see your oncologist and they treat the disease and I help you heal. So integrative medicine therapies are used to help you heal, whereas the conventional therapies that you're going through for your cancer is treating the disease. Effective interventions that are natural and less invasive and can be used whenever possible. A lot of the modalities used or recommended in integrative medicine are less invasive and they tend to be on the natural side. So a lot of people are more open to it. Integrative medicine neither rejects conventional medicine nor accepts alternative therapies uncritically. So I practice evidence-based medicine and evidence-based nutrition. So I try to, before I make any clinical decision, I always try to support my decision based on research that are available out there. So, so so when you're working with somebody, you want to make sure that they're making the best clinical decisions based on evidence. The concept of treatment and the broader concepts of health promotion and the prevention of illness are paramount. So integrative medicine, the way we approach things, typically works better ideally for the prevention of disease. However, if you are experiencing going through your journey right now, we're there to help mitigate these what the symptoms that you might be experiencing. So these are my tenets of wellness. It's slightly different than the ones that are out there that you might find or have seen, but these are the tenets I work with my patients that I find that's very important. And if you can address a few of these, you will probably most likely start to feel better. So number one is hydration. Drinking water is really important. I don't think a lot of people drink enough water. My rule of thumb is to drink half your body weight in ounces of water. So if you weigh 150 pounds, ideally you should be drinking about 75 ounces of water. Now, everybody's situation is a little different. So, but generally that's the rule of thumb. And I know a lot of people try to avoid drinking a lot of water before bed so you don't wake up in the middle of the night and have to use the restroom. Now, movement, I say movement, I did not say exercise because movement is important. You've got to move no matter what. So to prevent your body from getting stiff, you're articulating your joints and being able to move. Whether if you're laying in bed, try to move as much as you can because it increases the circulation and so your body doesn't get stiff. But if you're able to exercise, it doesn't have to be hard, something gentle that's appropriate for you wherever you are. Nourishment. Nourishment, I'm not just talking about diet. Nourishment is food that feeds you, not only your body, but also your soul. So for me, I love to eat spicy and spicy food nourishes my body. Like I feel better. My mood is improved when I eat something spicy. So most people don't feel that great eating spicy food, but for me, it what nourishes me and my body and my soul. Expressing your emotions. This is super important. So I've been working with cancer patients for over 10 years, probably close to 13 years now. And one of the things that I find that a lot of my patients don't express their emotions enough. They tend to hold everything in. They don't want to bother people or talk too much about what they're experiencing because they don't want to make people feel down. But I feel like it's really important for you, my patients, or anybody to share how they're truly feeling inside because if you're holding that emotion in, it's not good for your health, it's not good for your mental health, it's not good for your body. And it's very cathartic just to be able to talk and express how you're feeling, whether it be with your friends, your family, a therapist, a religious leader, whoever that's in your life that you feel comfortable speaking to. I feel like everybody needs somebody that they can be vulnerable with and share what they're feeling inside because the mind body is connected. So if you don't express your emotions, it's trapped in your body and you're just gonna feel icky. So I'm gonna jump
Dr.
in.
Liem,
Yes.
sorry to butt in. This is Brittany from Debbie's Dream. We did have a question that came in. As you
Yes.
mentioned, water. Many
Yes.
people with gastrectomies have a hard time drinking water. So
Mhm.
what advice would you have for someone who might struggle with getting enough water due to this?
Due to this, try to eat things that are hydrating as well. So I know sometimes that's why I said not everybody's situation is different. So that's why taking small sips throughout the day, try to stay hydrated or eat things that are that's full of fluid, whether it be puddings or jellos or fruits, you know, that has liquid in it. So that also helps.
Also, one of your patients may be on here. She said you're her favorite doctor. Her name is Vanessa Woolley.
Oh, that's she also works at Moffitt. We're everywhere. Okay,
Love it.
so I'm gonna jump to adequate rest and sleep. This is super important. Oh my goodness, and I am guilty of not getting enough. Uh, so sleep is so important because you it impacts hormones, it impacts the inflammatory system in your body. So if you don't get enough sleep, you're actually causing more inflammation in the body, and it actually throws off your cortisol cycle, which can throw off your hormones. So it impacts pretty much every single cell in your body if you don't get adequate sleep. So I stress about good sleep hygiene. Try not to have work around in your bedroom. Avoid watching TV in the bedroom as possible. Try to keep your room nice and organized. Make sure that you have clean sheets and bedding on the bed. All those things help you sleep better. Keeping your room at a good temperature where you're not too cold or too hot, because sleep is so important. It's one of the most important parts of the day because your body is healing at that time. So sleep, um, try especially uninterrupted sleep. Now, I also put community and social health. Our interactions with our community, friends, and family is actually makes a bigger impact on our health and longevity in life more than diet and exercise. There are more and more studies coming out showing that social health is paramount. So get out in the community if you can, whether it be volunteering or going to church or starting like a book, going to a book club or playing, what's the, oh my gosh, mahjong. All those things are great just to get out and do something and interact with others because that's how we connect heart and heart with other people. Now, self-care. This is difficult because I grew up in a generation where self-care is more of a luxury than a necessity. And unfortunately, in today's world, self-care now is a necessity and not a luxury. And especially if you're going through your cancer journey, self-care is important. And it doesn't mean you have to spend money. It means just finding time to take care of yourself and doing something for yourself, whether it's soaking your feet in warm water or taking a walk, meditating, whether it be going to the library to read. But if you can, go get your nails done, get a facial, get a massage. All those things are great for your health because it helps reduce stress, which reduces inflammation. Reducing inflammation helps with your immune system. So it's compounds and has a lot of benefits to it. And digestion. Now we're talking about gastric cancer here, and everybody knows that digestion is so important. And try to eat foods if you can, if you are eating, and if you can eat foods that are good for your body. Try to avoid, you know, overly processed foods as much as possible. It's not always 100% possible. Sometimes you're just not in the mood to eat something that's healthy. You know, I'd rather my patients sometimes get some calories in them. However, whenever you're in a mood and you're feeling good and you're able to digest food and eat food, try to eat the rainbow whenever you can. Choose foods of different colors. You know, a nice balance. I love to recommend the Mediterranean diet for my patients because it's more balanced. You get a little bit of beans, you get a little bit of grains, protein, a little bit of dairy, and good fats in your diet for those that can eat those types of food. But improving your digestion is really important, making sure you chew your food thoroughly and mindfully and not rush. And that way your digestion can, regardless if you don't have a stomach, the food is in smaller particles so you can actually try to digest that and absorb the nutrients as much as possible. Because digestion actually starts in the mouth. So I'm going to go into the history of Chinese medicine. I'm going to focus more on Chinese medicine because that's more of my background, and this is a modality that I personally use with my patients a lot. Chinese medicine dates back to 3,000 years old at least. There's some evidence that it goes back to 5,000 years. Concepts of restoring health is more than merely the absence of disease. We're trying to put the body in balance. So we're not treating the disease. We're trying to treat your body to put your body in a balance so you can heal yourself. Maintaining balance throughout the body and understanding the body as a whole, integrated whole. Again, the mind, body, spirit connection. We are more than just our body. The way we think, the way we feel affects how our body is, and vice versa. In Chinese medicine, it is a whole system of medicine. One of the tools that I use a lot, and that's what a lot of people think of when they think of Chinese medicine, is acupuncture. And acupuncture is just one modality that we use in Chinese medicine. Remember, it's a whole system of medicine. So we have herbal medicine. We also have exercises like Qigong, Tai Chi. We use manual therapies like Tui Na. It's like a type of massage that's specific to Chinese medicine. We really focus on diet and nutrition and mental health, because we believe how our emotions can really affect our body. The benefits of Chinese medicine and acupuncture for cancer patients. We're known for pain reduction. That's something that's very well researched for Chinese medicine. Acupuncture is the reduction in pain, but also can help relieve stress and anxiety, depression, and insomnia, which I think we all need a little help with. Most importantly, it can help alleviate side effects of chemotherapy, such as nausea and vomiting. It also helps with dry mouth from radiation, alleviate peripheral neuropathy that you get for specific type of chemotherapies that are platinum-based. It can also help with hot flashes for those that have hormonal-based cancers. And basically, it helps support and modulate your immune system and so much more, because as I explain how acupuncture works, you'll understand. So in Chinese medicine, we believe that your body is full of meridians and channels. If you think about it, we have these meridians and channels, but I like to think of it as the nervous system or the lymphatic system, the muscular system, or the myofascial system, because those basically traverses your whole entire body. People always wonder why I would needle something on the foot that would affect their digestive system, or I would needle something that's on their head that would affect their knees, because our body's full of nerves. And there's a saying in Chinese medicine: when there is free flow, there is no pain. When there is no free flow, there is pain. So that's a saying that I want to describe, like these meridians. Imagine it being like the streets on the road, the freeways and the highways. And the cars that are moving through it is the qi, the energy that is flowing through your body. And if there was a car accident, things start to slow down and build up. So think about it as the acupuncture needles is like the policeman redirecting traffic to get traffic flowing smoothly again. So that's why there's a saying that when there's free flow, there is no pain. When there is no free flow, there is pain. So imagine yourself having a crick in your neck or your shoulder, and you got a knot there, right? So think about how that might impact you. It can actually cause you to have a headache. You might not think clearly. It might impact your mood. You might be a little irritable and testy. So by massaging or using acupuncture needles to release this, your mood improve, your headaches might reduce. So that's the concept of Chinese medicine, is to improve the flow in your body so things can move smoothly and your body's more balanced, to keep your body nice and strong so you can feel better no matter what you're going through. Now, it's important for me to talk about what acupuncture is not. It's not based on religion. These are very common questions I get. And it's not based on energy, medicine, magic, or voodoo. I talk about qi, and I say qi because that's a concept that we use in Chinese medicine that dates back 3,000 years ago. However, qi, if you can think about it, is kind of like a force that helps things move in your body. I think of it as like ATP. Your body, your cells have the mitochondria. It produces energy called ATP, and it causes things to happen and function in your body. Now think about it. We might not see it. We might not know about it. So I like to also bring up the moon and how the gravitational pull impacts the waves in the ocean. So we don't see it, but that energy, the gravitational pull, actually impacts the waves. And it's not an alternative to conventional cancer treatments and therapies. A lot of the times, a lot of patients would come to me hoping that I would give them alternatives to their treatment to avoid chemo, radiation, immunotherapy, whatever the therapies are. However, I'm integrative. I believe that my medicine complements and is better to be working side by side with conventional treatments. So we're not an alternative to the therapies. We're just there to support it. And we do,
Dr. Liem.
yes, there. Yes.
I'm sorry, I didn't mean to cut you off. We did have a question that's in reference to acupuncture. It
Yes.
says, those of us who've tried acupuncture love it. And some people might be afraid of the idea of being poked by needles when they are already poked enough for IVs. What
Yes.
would you say to quell their concerns regarding the needles?
Okay, let me just finish this last point and then I'll talk about that. So we do not target tumors or prevent cancer cells from spreading. However, it provides significant benefits to cancer care. Now, to talk about, and it's not this, okay? This is not what acupuncture is. It's glorified in movies and TV shows and used in a lot of for humorous effect. But my patients do not look like this at all. So let me talk about what is acupuncture and to quell your concerns about being poked with needles. It involves the insertion of a very thin sterilized needle to specific points of the body to promote healing. Now, these needles are so thin, if you can see in the picture, about 30 to 50, depending on the size of the needles, of these needles, it can fit into a hypodermic needle. So the needles where they inject medications in you or draw blood from you, those are very thick and can be very uncomfortable. The needles that I use are small. A lot of the times my patients don't feel me even inserting the needles, and if they do, it usually is a muscle spasm, muscle jump a little bit. And if they ever feel uncomfortable, a burning sensation where the needle might go into a hair follicle, I just adjust the needle, and a lot of the times I will tell you 90% of my patients do fall asleep. So they are comfortable, and I understand the fact that you've already been poke and prodded when you go to get treatment, and the last thing you think about, you're like, the last thing I want to do is to get poked. However, sometimes your side effects can be so much that lowers your quality of life. And I think it's a great alternative if you're open to it. I'm not saying it's for everybody. If you're open to it, give it a try. And also tell your provider that you have these concerns so they can be a little bit more gentle, because I can only speak to how I approach it with my patients. I specialize in cancer. I've been working with cancer patients for a long time, and I have a tendency to be more on the gentle side. I'm more aware. So I'm not as aggressive with my style when I needle with my patients, where depending where other providers, their training or where they're from, typically sometimes they might be a little bit more aggressive. But definitely communicate with them, because we are flexible and there's always alternatives. If there are certain points in the area of the body that you are concerned with, we always have other options that we can approach a situation. So everybody, I will always tell people, I'm like, every provider has a different style, just like different people have different personalities. My parents own a salon, and I grew up in the salon business, so I kind of lean towards more of the spoiling realm, because I baby my patients a little bit, just because of the nature how I grew up with my parents running a salon. So definitely communicate your fears and your concerns, but keep an open mind that this might be a good therapy that you might want to implement to help mitigate some of the side effects and the after effects of your treatment.
Dr. Liem,
Yes.
one of our staff members, our programs manager, Jen, she says, as someone who's had it, I'm so surprised with how wonderful I feel after treatment is over. I feel as if I've had a full body massage.
Yes. So I would definitely touch on that. It's because the endorphins that's being released because of the stimulation of the nervous system. And the procedure is safe and painless majority of the time, because I don't have x-ray vision, but because I know the body pretty well, that I can avoid certain nerves or arteries. But sometimes, everybody's different because of surgeries, things move around. but generally it can be very painless. And actually, a majority of my patients don't even know I'm finished needling them. They're like, "You're done?" I'm like, "Yeah." Time for you to take a nap. So how does acupuncture work? The exact mechanism is not fully understood, but these are some of the research that shows how it works. So I talk about Chinese medicine. We believe in um, encouraging flow and circulation in the body. You know, when things are not circulating well, whether it be physically, the blood and the fluids in our body, or emotionally, things don't feel good. So we try to put things in balance. So acupuncture affects the hemodynamics of the body, such as blood pressure, heart rate, and blood flow. So one of the things that acupuncture can actually do is vasodilation. It helps increase blood flow and lowers your blood pressure, because that's one of the first things that can happen is once you get needled, your blood pressure can shift down a little bit. Now, some of you might have low blood pressure, and definitely let your provider know, because then they might want to put less needles in you. Now, the next one is it stimulates the nervous system by activating nociceptor sensory nerves and proprioceptor fibers that travel from the skin to the spine and into the brain. What that means is you put a needle in, we stimulate it, it affects the nerves, it sends a signal to the brain, and it causes the brain to release certain things to happen, such as relieving pain by releasing beta endorphins. That is that relaxing sensation. I call it that natural acupuncture high that my patients get when they walk out. They feel like they got a full body massage. They feel so good, and unfortunately, they have to drive themselves home. Unless they have somebody drive them. Because a lot of my patients are like, "Don't you have a driving service that can take me home?" Because sometimes you feel so good that you don't want to be sitting in traffic driving.
You
The whole,
actually have a testimonial, Dr. Lee.
yes.
Vanessa says, I used to have a lot of anxiety. Acupuncture was the best treatment I ever had, and Dr. Lee spoiled me a lot. I stopped taking anxiety meds after a few months of acupuncture treatment.
Oh, that makes
Lots
me
of
so happy.
cosigns.
Yes, so that's one of the things it does. Then that's why I love Chinese medicine, or integrative medicine in general, that you can do something that's pretty simple that has a global effect for the body. What you have patients that come in to be treated for pain, but then they have other benefits. They're digesting better, they're sleeping better, their mood has improved. So it's not, when my patients come in to see me for one cheap complaint, they walk away after with many other global benefits of their bodies. And so these hormones that are released from your brain actually suppresses pain and increase your overall mood, happiness, and pleasure. It also helps reduce inflammation. That is something that acupuncture is really known for. A lot of people use us for pain. People wait until they experience pain to see us, but I always like to remind people, like, it's always good to come in for maintenance to prevent the pain from coming. But also not only the inflammatory, and also the immune response. So a lot of my patients also notice that they don't get colds or flus as much. They don't get sick as much, because by reducing stress, by reducing inflammation, you're going to end up improving your immune system. It helps with wound healing. I do a lot of treatments for people that post-surgical treatments to help them heal faster. And one of the most common things I treat in my practice, unfortunately, is chemo-induced peripheral neuropathy. So with that treatment, the way I personally do it, I hook the needles up to electrical stim and stimulate the nerve endings for my patients. And that way that my patients has better balance, so they're able to reduce the medications that are required to help support them if somebody's experiencing peripheral neuropathy. Balance issues are, and fall risk is another issue with chemo-induced peripheral neuropathy. So just having that freedom to reduce the neuropathy, whether it be during the treatment and after. Now, there's different styles of acupuncture. Like I told you, everybody's training is very different. Chinese, I will let you know, those that are trained in Chinese medicine tend to be a little bit more aggressive in their needling style. Japanese is definitely more gentle. Korean style is more leaning towards the Chinese, and they do a lot more in the hands. I personally use Chinese and Japanese style in my practice. Just just to let you guys know, there are different styles, different personalities, and how they approach it. So if you go to one person, their style doesn't click with you, you don't like it, I would say definitely give somebody else a chance. That might work for you. Dry needling, and sometimes acupuncture can be, you can hear dry needling. What dry needling is not using acupuncture points, but using points to trigger um, a muscle to respond, to jump. So, like, I would use this muscle. The trapezius is typically very tense and taut, and a lot of people from stress, posture at work, sleeping position, laying in, getting radiation or surgeries, and can impact the trapezius from being the muscle being really tight. So I would put a needle right here and stimulate it, and the muscle will jump and fasciculate and then relax. So that could be called dry needling, could be also called trigger point, or even muscle motor point. That is acupuncture. And electroacupuncture, if you see the picture there, they're hooked up to a TENS unit specifically made for acupuncture. And I typically use this a lot for neuropathy, and only when patients are not responding to just acupuncture, I will hook them up to e-stem for pain conditions. Acupuncture for quality of life in gastric cancer patients undergoing adjuvant chemotherapy. This is a study that was published by Chu et al. In the Journal of Pain and Symptom Management, and it showed that in a study with 66 patients that acupuncture can help reduce the toxicity during adjuvant chemotherapy in gastric cancer patients. Basically, it helps increase the quality of life. The effects of acupuncture on chemotherapy-associated gastrointestinal symptoms in gastric cancer. This is another small study by Dole et al. And currently published in Current Oncology, 2017. These patients were being treated with oxyplatin paclitaxel, and it helps reduce the GI symptoms that one can experience, like diarrhea, abdominal pain, vomiting, nausea, and it's just an improved quality of life overall. But those that are getting regular acupuncture, you can help mitigate these symptoms. Now, a lot of the times people, and I love to talk about, does acupuncture really work, right? And the reason why people, when they look at certain studies, they're like, acupuncture doesn't really work for this condition, or it doesn't work for this condition, because the problem is each study is so different and designed so differently that when you kind of mush them all together and try to see if it actually works, some studies are not designed very well. So that can impact the results of that study to see if acupuncture really works. And is double-blind randomized controlled trials really double-blind? Because usually a patient will know if a needle is actually going in them if they're in a study, and they try to have a needle that pretends to puncture the skin, but it doesn't. But unfortunately, when you don't puncture the skin, but you stimulate the skin, the cutaneous level, that's Japanese acupuncture. Because sometimes Japanese acupuncturists don't even break the skin. They use the needle to stimulate the nervous system just on the skin to cause an effect in the body. So is it really double blind? And is it just a placebo effect? Well, a placebo effect is still an effect. And many of our doctors use the placebo effect without us knowing. So for example, I always like to remind patients that sometimes they get prescribed an antidepressant. And in medicine, we know that antidepressants generally do not start to work until 4 to 6 weeks later. However, people sometimes just start taking the medication and start to feel better already. So that placebo effect is still in effect, so it's still beneficial for you. So, and there's a lot of studies using animal models, whether it be rabbits or dogs or even mice. And if it works for animals, is it a placebo effect if the studies are working for animals. Just food for thought. So any more questions on acupuncture before I move on? All right. One of my favorite things, massage therapy, is one of the modalities in integrative medicine that I feel like is so approachable, and it is not a luxury, it's a necessity. And I'm not talking only for cancer patients, I'm talking about the caregivers as well. Massage is great, it increases circulation, it improves quality of life, reduce anxiety. I mean, you can see the list there. It helps support um, all cancer patients, all caregivers, and pretty much anybody. It helps increases the flow of the lymph system, which is really good. If you're experiencing lymphedema because of surgeries, helps actually relax your body, put your body in parasympathetic so you can digest better. So there's a lot of benefits. Now, the one thing I want to stress for those of you on here, it is really important to be able to work with a massage therapist that is trained in working with cancer patients going through treatment or after. So this is a website, a good resource, the Society of Oncology Massage. So no matter where you are in the US, you can go to this site and try to find a therapist that is registered and been trained with the Society of Oncology Massage, because they know how to work with cancer patients. You cannot just go to somebody because they might not know that there's certain things that they can't do regarding massage if you just had chemotherapy, if you just had radiation or immunotherapy, whatever it is best to work with somebody that is qualified to be able to support you through your journey. So I stress this, please take a screenshot. I'll write this society's name down. It's a great resource for you. Yoga, another one. So yoga is another approachable modality used in integrative medicine. It helps improve physical function. Remember, I told you one of the tenets of wellness is movement. It doesn't have to be aggressive. It could be restorative yoga where you do a couple poses and you stay there and relax and breathe. It helps reduce fatigue, reduce stress, improve sleep, reduce pain, and improve lymphatic flow. We're very blessed and lucky to have 2 yoga therapists here at Moffitt Cancer Center that are able to help patients, inpatient and outpatient, to come up with a routine that works best for them with whatever limitations they might have, whether it be post-surgery or you recover from surgery. Working with a yoga therapist that can tailor a workout for you to help you strengthen yourself, to improve the flow in your body is really important. I recommend yoga to my patients a lot. I recommend massage a lot to my patients. I feel like it's critical to implement these type of modalities during your journey. We're very blessed and lucky that these therapies, such as yoga, is free for patients to access for the Moffitt patients. And this is a fun and interesting study that came out last year in supportive care in cancer, that therapeutic yoga reduces pro-tumorigenic cytokines in cancer patients. Cancer survivors, 16 weeks of therapeutic yoga reduced cytokines associated with chronic inflammation. Exercise reduces inflammation, reduces stress. Breathing that you do in yoga reduces stress and inflammation. All these things are really good for you. So whether it be, if you just implement one thing, it can make a big change in your body. Another therapy that when you go see an integrative medicine provider, they might recommend is meditation. Full disclosure, I'm not very good at meditation. I'm very type A, I'm always on the go. However, I find moments in my day where I try to be mindful, whether it be spending time paying gratitude to the things I'm grateful for in life. That also is meditation. Walking, listen to music where you get lost in your walk, or listening to your music is also meditation. So it's not always about sitting there quietly and focusing on your breathing. There's many ways. So those of you that feel like you get more stress and anxiety trying to sit there and you can't quiet your mind, there's other ways to go about it. Meditation for cancer patients, along with standard medical treatment, helps lessen stress, anxiety, improve mood, improve immune function, reduces fatigue, increase energy, improve sleep, and also reduce pain. Mindful meditation that we do here at Moffitt is a guided meditation. So those are things that you can also download on whatever streaming device that you have. Even YouTube, I tell my patients all the time, find a guided meditation on YouTube, whether it be a male voice, a female voice, a male voice that has a British accent, whatever it is that's going to benefit you to help you. I personally like guided meditation because I don't get lost in my thoughts of the noise of my own mind. I prefer to hear somebody else speaking and help guide me to that relaxation point.
We also got a comment from our programs manager, Jen. She says she likes to listen to meditation as well as a wonderful practice, and she likes to let the music help her mind float away.
Yeah, I love music. Music definitely helped me drift.
Same for me. I actually live by meditation. I like the guided ones, and it's definitely helped me manage anxiety for sure. Melanie says she wished that someone had told her about acupuncture 15 years ago when she was first diagnosed, and she says that she tells everyone about it now.
Oh, that's great. Thank you for being an advocate. That's the thing. I try to educate as much as I can the community at our cancer center, but I try to educate as much as I can in the community at large about the benefits of integrative medicine and the various modalities that can be used to help support cancer patients through their journey. But not only cancer patients, the caregivers too. Their caregivers, it's really important for them to implement some of these things to help take care of them so they can take care of our patients as well. It takes a village and it's teamwork. And the thing is that acupuncture sometimes is not accessible to everybody, whether it be because of insurance. I'm very blessed and lucky that I come from, I grew up in San Diego, and the school I went to, we are throughout the community in San Diego. We had a clinic at we have a clinic at the UCSD Cancer Center, and we treat patients for free. Massage was also free. So check out your resources, and whether it be grants or whatever it is that's out there to make these type of modalities accessible to you. At our cancer center, definitely, if you're getting treated at Moffitt Cancer Center, reach out to our department. Massage is free for patients that are inpatient. We have yoga, meditations accessible for patients, also in Spanish for the meditation. Let me see here. Oh, we're at the Q&A. So totally open for any questions for the next, I'll be here for the next 15 minutes or so.
Awesome. So we did have a few comments come in. Elizabeth says, is deep breathing yoga recommended for those of us with no stomach?
Yes, but now here's the thing that you don't want a lot of gas buildup, so definitely make sure you exhale and try to use the diaphragm to push out all the air. Breathe through your nose and exhale fully through the mouth. I think it's really important. And also yoga, like child's pose too. Definitely work with somebody at the beginning to help make sure that you're doing correctly, and so you don't hurt yourself, because some of you may have had surgeries already, and so you want to make sure that you're moving correctly, you're in the right position. But definitely it is really important because breathing is important, and we have a tendency to hold our breath when we're under stress. And
Awesome.
I'm guilty of that too.
The next, we have a comment. Someone says the Calm app is their favorite. Oh, that's our programs manager. She says the Calm app is her favorite, worth every penny. It's the most relaxing voices behind the meditations. I think I've heard of that app. That
Yes.
actually,
It's a very popular app, and I recommend that to my patients. But sometimes apps where they have sometimes may have fees are not accessible for everybody. So YouTube, there's plenty of stuff on YouTube. You find the ones that you like, make sure you like it or put it somewhere on your page, and so you can always go back to it.
I actually create playlists on YouTube, like I love it. Vanessa says, is playing relaxation music while sleeping at night okay? She says she worries sometimes because she doesn't know if her brain is resting.
That's true. So make sure the volume is in the right place. Might not be for everybody. I cannot listen to music when I'm sleeping. However, I have a white noise. I prefer white noise. That helps me sleep deeper. Everybody's very, very different. So if you have a watch that tracks your sleeping, that's a good way for you to find out if it's affecting your sleep and impacting your sleep. Or set a timer to the music to turn off after 15 or 20 minutes.
Dr. Liam, are you familiar with, I've heard somewhere that subliminals, speaking of like playing things while you're sleeping, is that a thing? Like subliminal, like affirmations or like
Oh,
just
yeah.
positive messaging?
Yeah, so that's like guided meditation. That's basically, the subliminal. I hate to use this word because, it's kind of like what hypnotherapists use to help people with whether it be stop smoking. Basically, it's guided meditation.
Okay.
That's what it is.
And is that helpful? Is that
I
helpful?
believe
Like,
so.
how
No,
does it work?
so what it does is that one, you listen to it and you remind yourself. It's like a reflex, right? So it's kind of like when people wear rubber bands around their wrist when they want to stop something, they snap themselves. Well, that's a negative response. However, with like guided meditation, you listen to something. It's like basically you're programming yourself to relax. So one of the things that I do in my practice, I turn on music and I have the same playlist for the last over 10 years and I don't change it because a lot of my patients, when I change it, they're like, no, put it back to your old original playlist because when I hear the songs that I already know, I automatically relax because they're already programmed to relax when they hear a certain type of music. So, like those messaging, like when they remind you to breathe, and so it's kind of like you already been listening to this track that you body automatically start to do it on its own without even knowing.
That is so cool. Um, well, if we have more questions coming, please feel free to drop them in the comments, everyone. This has been a great, very informative program, by the way. I definitely learned a lot.
Oh, thank you.
Um,
I'm glad. Yeah,
someone,
that's why I love what I do because I get to help my patient thrive through their treatments, no matter what. I love, of course, in my dream world, I love to start working with the patient right when before they even start treatment. Unfortunately, not everybody discover me or find me before they start their treatment, so we can get a game plan going to take care of them. For me to get to know them and to take care of them, but I work with patients during their treatment to help mitigate the neuropathy because sometimes the neuropathy can get really bad where they have to stop the treatment. Sometimes stopping the treatment is not the greatest idea, but sometimes the side effects are just so bad that they have to stop the treatment. But even though the treatment is helping them, so I have a lot of joy to kind of help my patients like cross that finish line. And during survivorship, it's super important because a lot of patients always tell me they're like, we have all this support from the hospital and our community, our family when we're going to get treatment, but when we're done with treatment, we're out on our own trying to figure out and putting our team together to put our body back into balance as best as possible. So, I'm just one part of that team to help my patients get back to being fabulous again.
and you are so appreciated for it. We have a comment or someone says, I may have missed it if you talked about it, but sometimes hospitals or clinics offer something called dry needling. Can you comment on what this is, what the
Yes.
cautions are, etc.?
Okay, so I'm going to be very, very open about this. So I did speak about dry needling. So dry needling is virtually acupuncture. They're using dry needle. So what dry needle means is that we're not injecting anything in you. So like say if you were to get a B12 shot, that is wet needling because they're actually injecting a fluid in you. Dry needling is just acupuncture. However, it's semantics because there are medical professionals that cannot do acupuncture because only a doctor who is trained in medical acupuncture can do acupuncture. Only a Chinese medicine doctor or an acupuncturist can do acupuncture. So dry needling is semantics. Basically, so physical therapists, chiropractors, or other medical providers to use a needling technique. So
Clever.
they would have to get training in it as little as 30 hours. So, so take it with with a grain of salt. Like there's physical therapists that are doing dry needling. There are people that are very well trained in dry needling, and there are some that only did 30 hours. So, but the great thing is that if they were to treat pain in physical therapy and they're doing dry needling, usually insurance might cover it. Let me see what else. The concerns that I have with dry needling and other providers is that the lack of training. We have like in Chinese medicine, we have over 1,000 hours worth of training in needling alone and experience before we even graduate, in comparison to other providers. That I'm just being real about it, but I'm not saying there's not qualified people that can do dry needling very, very well.
Thank you for that explanation. We actually had a couple of questions that came in regarding acupuncture. So Lisa says she missed the URL that you mentioned as a way to find experienced providers. And if you can repeat it, we can post it for her. And then we had Amy who says, what are the best credentials to look for when searching out an acupuncturist who's experienced in treating chemo-driven their neuropathy?
Okay, so one of the things that you want to ask, okay, so let's start with massage. Here's the site for massage therapists that you want to, as a resource to refer to. And now, in finding an acupuncturist that can support you, I'm actually one of the few that actually specializes in cancer. There's not that many of us. There are providers that can treat cancer patients or have treated cancer patients that might not say they're cancer specialists. So the way I would have people look for is, one, look at their bio to see what their training is, okay? And if they came from a good school. And how do you know that? I would do a quick Google search on the top schools in the United States for acupuncture. Usually they're more, they get a more larger breadth of training. Like my school is very well known for orthopedics and internal medicine. So, and call them up and ask them, are you comfortable? Have you treated cancer patients? And how do you go about it? With peripheral neuropathy, I've done a clinical trial at Moffitt, and I use electrical stim with my treatment for neuropathy. So that is something you might want to ask the provider if they use a TENS unit, electrical stim, for the needles to treat neuropathy. Okay, so I find, based on the research that's out there that's published and my own clinical trial, that there are, it improves the peripheral neuropathy a lot quicker and better and more sustained benefits if they use an electrical stim. So if you can find a provider that uses that, not everybody uses it. I would say a good majority might be using it. So that's something specific for neuropathy. If you're looking for somebody to treat that, ask them about that.
So is this URL that you're sharing, is that for acupuncture as well, or just massage therapy?
Just massage. Just massage.
Okay.
Unfortunately, depending on the state you're in, we don't have a huge national organization. We kind of do, but in California, we have our own separate licensing board. The California boards is different from the national board. Say where I am working right now in Florida, you have to be certified nationally to get your license in Florida, but in California you don't. So it's kind of hard to find resources depending on the state that you're in. But the National Chinese, let me look it up really quick, sorry. It's the ncaaom.org would be for all, of the United States to look for a provider. Yes, I'm sorry. It's the NCCAOM, the National Certification Commission for Acupuncture and Oriental Medicine. So state by state, they have different requirements for your provider. Like in Florida, you only need to have a master's to be a practicing provider. So not everybody has to have a doctorate to be able to practice.
Okay, and I believe the next question was, hold on a second. The next question was from Janice. She said, I might have missed this, but as for yoga, are we looking for experienced yoga instructors who can accommodate the poses or stretches to our physical changes? I've only done yoga with one who had surgery like ours, so she was very aware of our needs and limits, especially while healing. Thank you.
Yes, definitely. I love that she was able to work with somebody that also understand her journey and help modify things to make it safe and effective for her. I mean, if you can, definitely find somebody with more advanced training to the ones that know how to work with patients that had surgeries. There are a lot of yoga therapists out there that have gone to get advanced training to work with people with various conditions and limitations. So definitely look for one, and I highly encourage if you can find one and set up a private one with them so they can work with you one-on-one if it's accessible for you. If you're a patient at Moffitt, we have two for you.
Thank you. Lisa says she really appreciates this information, and she's appreciative for the session. Thank you, Lisa. We try to be as helpful as possible, and Dr. Liem is very resourceful, so we appreciate him joining us.
Thank you. You're welcome. Thank you for having me.
Yes, I don't know if anyone else has any other questions. We have a couple more minutes. Please feel free to drop them in the comments.
Well, then, since we're waiting for another question, this picture is a picture of one of my patients, and she's posing for a photo shoot for yoga for Moffitt, and she's also became a yoga therapist herself.
Oh, that's pretty cool. Amy just said, thank you so much for your time and excellent information. Amy is one of our patient mentors and advocates. She's a patient herself. Amazing.
Thank you, Amy.
I love this picture of your patient, by the way. Super cool.
I know. So
She
proud
looks,
of her. So proud of her.
yeah, she looks so confident and like, yes, I got this. Love
Yeah,
it.
like Sharon, our yoga therapist at Moffitt, and I really encouraged her because she planted that seed with us, letting us know like she's interested in becoming a yoga teacher, and we kept on pushing her and telling her like, go for it, and she did it. So proud of her.
That is awesome. Well, it doesn't look like we have any more questions, but we're definitely at the end of the program. So I would just like to, on behalf of Debbie Stream Foundation, thank you so much for being willing to host this program. Lots of information that's so good. It's going to be recorded and available on our website, on our YouTube channel, as well as here on Facebook. You have Vanessa, who is your biggest fan. She says, thank you so much. Thank you, my special Dr. Lee. Amazing information is what she says. So we appreciate you so much for taking the time out of your schedule to join us today.
You're welcome. Thank you.
Can we, I think there's one more slide where we'd like to acknowledge
Oh, yes.
our generous sponsors for today's program. That's Amgen, Daiichi Sankyo, and Merck for allowing us to put on programs like this informational session today. We greatly appreciate all of our supporters and all of you for tuning in. And until next time, see ya.